Hello and welcome to Group 6's PSA message regarding safe-sex practices for young adults. Our group decided to choose this demographic because it's a vulnerable population who are affected by a lack of safe-sex practices. We found that 15 to 24-year-olds make up about half of all new STI cases and that 75% of unattended pregnancies are in the group age between 15 to 19 years old. These rates are highest among other developed nations. When looking at this graphic below, it shows that over half of the most common STI cases are found in this. Young adults are more likely to participate in riskier sexual behaviors that jeopardize health outcomes and threaten the goal of health equity. Some risk factors include having multiple partners, engaging in unprotected sex, using recreational drugs or alcohol, neglecting to get regular testing for STIs, HIV, and more. These unhealthy behaviors incline young adults to have higher rates of STDs and unplanned pregnancy. Safe sex practices are important for young adults because they prevent unexpected or unwanted pregnancy, prevent the spread of STIs such as chlamydia, gonorrhea, HPV, herpes, HIV. It helps decrease or prevent body fluid exchange during sex and can improve communication with your partner. This is especially important when considering that some STIs can be treated with antibiotics, but others have no cure. Unfortunately, many barriers exist in promoting safe sex practices. We believe the most influential barrier is education. However, a gap exists between comprehensive and abstinence-only sex education in grade schools. This is due to the involvement of political and religious groups. Funding from federal government to schools that offered abstinence-only education has been around since the 1981 AFLA Act, which saw the involvement of pro-family religious groups. This stemmed a further push for 37 states to legally require abstinence-only education in our nation. We believe that exposure to comprehensive sex education, access to health care, and utilization of community outreach programs can reduce this health disparity. Other solutions to encourage safe sex practices are anonymity, as it gives students a sense of security when reaching out for help or when needing to buy the right tools to perform safe sex, such as condoms, birth control, and etc. Also, offering a complimentary online course through educational institutions can provide benefits that will allow students to read about safe sex practices from the comfort of their own home. Providing young adults with accurate and appropriate information on risks and resources pertaining to healthy sexual behaviors and family planning gives them an opportunity to make informed and healthier decisions. As previously mentioned, resources in discussing responsible sexual practices and behaviors promotes the practice of safe sex. In 2010, the Affordable Care Act increased access to preventative services for millions of Americans, including young people. Now, anyone can access inexpensive and free reproductive health care benefits such as birth control, condoms, reproductive health screenings, STI and HIV screenings, and more.